Hello, everyone. Good to see you again. I'm Anne-Marie Green.
And I'm Vladimir Dutier. Coronavirus fears are sending shockwaves across the globe. The virus is blamed for killing more than 2,800 people, and it's now having its most adverse impact on the financial markets. We expect more turmoil today after the Dow Jones Industrial Average plunged almost 1,200 points. That was the biggest one-day drop in history. The Dow has lost more than 2,600 points since Monday, nearly 10% of its value.
Yesterday, President Trump looked to put worries at ease.
The virus, we're doing a very professional job. We have the best people. Our vice president is working very hard. We have tremendous people involved, and we're doing, as I said, we're at 15 people, and they're getting better. We have one that's quite ill. Got them late, and but we have a country that's pulling together really well. I think the Democrats should not try and make this, or the Republicans should not make this a political issue. This is above politics.
Well, the worldwide outbreak has topped 82,000 cases in at least 52 countries. And now California is putting new quarantines in place because of what's suspected to be the first U.S. case with an unknown origin. Carter Evans is outside the hospital in Sacramento, where that patient is reported to be in serious condition.
Well, there is still a lot of uncertainty surrounding this case. Health officials insist the risk of acquiring the virus in the area remains very, very low. Still, they say this kind of transmission makes containment especially challenging.
This is a random individual in a community of 450,000 people.
Health officials say the patient first came for treatment here to North Bay Vaca Valley Hospital. After her symptoms worsened, she was brought to UC Davis Medical Center, and it was days before she was diagnosed with coronavirus.
Which means that there were multiple healthcare personnel who were exposed to the individual. Some of them are under isolation. Some of them will be under quarantine.
Both hospitals are near Travis Air Force Base, where hundreds of Americans returning from China and Japan were quarantined. But officials found no connection between the woman and anyone at the base. They are trying to find everyone she may have contacted. How many potential contacts are you tracking right now?
I can't give you those specific numbers, but I can tell you that they continue across the full spectrum from the individual's home all the way through the hospital system.
California is monitoring 8,400 people for the virus, but the governor says the state had just 200 coronavirus testing kits. He says federal officials are promising to send more.
I'm not going to politicize this moment, and I'm not going to point fingers. We have had a very strong working relationship with the administration.
The federal government is working to increase testing capabilities nationwide. At least 40 labs are now able to test for coronavirus. That number is set to more than double to 93 by Monday. After the Dow Jones closed down more than 1,000 points Thursday, President Trump tried to ease investors' fears about the virus' impact here and abroad.
We have done an incredible job. We're going to continue. It's going to disappear. One day it's like a miracle. It will disappear. And from our shores, it could get worse before it gets better. It could maybe go away. We'll see what happens. Nobody really knows.
CBS News can now confirm a Department of Health and Human Services whistleblower has filed a complaint alleging workers responding to American evacuees from China weren't prepared. The complaint says those who monitored people at 2 military bases were improperly deployed, and they did not have the necessary training or equipment. Some worked without full protective gear. One even took a commercial flight once the work was done. Now, one of the Air Force bases where this apparently happened is in the same county where the patient here became infected. Vlad and Anne-Marie?
All right, Carter, thank you. For more on this now and how the U.S. government is responding to the crisis, we want to bring in CBS News White House correspondent Paula Reid. So listen, Paula, we just heard Carter mention that there is a whistleblower sounding the alarm over a lack of training and protective gear for U.S. health workers. How is the White House responding to this?
Well, so far, the White House has not responded at all to this complaint. They have deferred us to Health and Human Services. Now, according to this complaint, Health and Human Services reportedly sent about 14 workers to receive Americans being evacuated from Wuhan without proper training and without proper equipment. The Health and Human Services Secretary, though, Alex Azar, he has denied this. And even when he was pressed on this during a hearing, if perhaps the urgency of the situation may have forced some folks to cut corners, he denied it. Now, this complaint is being reviewed, and it will be incredibly damning for the secretary if it turns out that he was not being honest here.
As you know, Paula, President Trump is being called out for countering what U.S. health officials are saying about the outbreak. This week, he told reporters the United States is doing a great job and that the virus will disappear. But at the same press conference, we heard from medical experts who told the United States to prepare for the potentiality that the coronavirus, the number of cases here in the country will expand within within the United States border. So why is the president on a different page than the medical community?
Well, it's interesting. The president seems to think what investors, what Americans want is to be reassured, when in fact what a lot of them want are facts. They want science. They want information. And reportedly, the White House has decided that all messaging from any of the government agencies on coronavirus should go through the vice president's office. But that was denied by Vice President Mike Pence's chief of staff yesterday when CBS News asked if that was the case. But yesterday was supposed to be a display by the White House of a more disciplined strategy, right? The first day of their rollout, overseen by the vice president, showing people that they had this under control. But yesterday, the president used an event to mark African American History Month to rail against the media, to praise himself for keeping the number of cases low, and for once again suggesting that the threat is being overstated. So it's not clear if the White House is trying to keep everyone on message, but it appears that yesterday the president is the one who was really not necessarily on message and not being consistent with the kind of information that Americans really want as they become increasingly concerned about the spread of this virus.
So, according to the Washington Post, former federal officials and public health experts have been warning for years that this country is not prepared for a dangerous pandemic. What is the Trump administration doing to ensure that the U.S. is prepared?
It's so interesting because during these events, the president is being forced to rely on the kind of experts, the kind of bureaucrats that he has for so long attacked or fired or dismissed. The White House official in charge with leading the U.S. response in a pandemic, he left about 2 years ago when his global health security team was disbanded. Federal funding for a lot of prevention or mitigation for the spread of infectious diseases, it's only been under threat during most of this administration. The president was asked about this, though, at his press conference on Wednesday, and he said he's not worried about it. He believes it's better to work with a thinner staff and that he can just call up the experts when he needs them. But the experts dispute that. Experts say no. In order to really have a robust response, you need planning and you need investment. You can't just call folks up at will.
And Paula, the president and his surrogates are asking Democrats and they're asking Congress and they're asking the media not to politicize this, but it hasn't really been politicized. I've seen both sides of the aisle trying to come up with solutions, as evidenced, for example, by Senator John Kennedy of Louisiana, who grilled the acting Homeland Security Chief, Chad Wolf, about his ignorance when it comes to the coronavirus. He hit him pretty hard, and this is a senator who has pretty much supported everything that the president has said and done over the past couple of years. But Senator Kennedy, realizing that the coronavirus does not look at whether you're a Democrat or a Republican or a member of the media or a member of Team Trump. It is an infectious disease that affects everybody, and he was trying to get some answers, and he wasn't able to get it from the guy who's supposed to keep us safe.
That's right. But I will remind you that House Speaker Nancy Pelosi, she certainly slung some mud over here at the White House, calling the president's response anemic, criticizing his understanding of science. The president fired back on Twitter last night, in some ways suggesting that Democrats were trying to make the whole situation worse to undermine him and his chances of re-election. So this partisan bickering certainly does not help. But behind the scenes at the staff level, they continue to try to work on solutions. Specifically, what they have to figure out first and foremost is funding. Obviously, that's something that has to go through Congress, and they have to reach some kind of bipartisan agreement.
So speaking of funding, the president wants $2.5 billion. Is it likely that Congress will give him what he wants?
Well, he started out saying he wants $2.5 billion. Senate Minority Leader Chuck Schumer came out and said that's not enough. He proposed something that was about 4 times that, about $8.5 billion. The White House officially said they weren't willing to get behind that. But the president did express some flexibility on Wednesday that he could be open to freeing up more money to deal with this crisis. Again, behind the scenes, even while the speaker and the president are exchanging barbs, behind the scenes at the staff level, they continue to work and try to get an accelerated schedule for passing this funding, freeing up these funds so that they can help local and federal resources respond as this continues to spread.
And Paula, real quick, just to confirm and just so our audience understands, the Office of the Vice President Mike Pence is in charge of this task force. It is not the Health and Human Services Secretary Alex Azar.
Well, Vlad, that's a
Okay,
great question.
I'm confused.
I'm gonna have to look down at my notes for our viewers so I get all the facts straight, because I need an org chart.
I know. I was going to say, right? And the reason I'm saying this, Paula, is because it really isn't that clear. You're getting these are the mixed signals that we're getting, that it makes it hard even for those of us who do this for a living to keep track, because
Completely.
Yeah.
That's why I have my handy org chart. The vice president was actually asked about this yesterday on camera by journalists, and so this is the way it breaks down. The vice president, has been tapped to oversee this response, to coordinate with local officials, but he is not a czar. There had been some suggestion that they could appoint a czar. That is not his title. He's just overseeing this. But we have to remember the Health and Human Services Secretary, Alex Azar, he is also overseeing this, but he's seeing it apparently sort of either on parallel or reporting to the vice president, who reports to the president. And in another twist, the vice president's office also announced Ambassador Debbie Birx, a global health official and physician, will become the administration's new coronavirus response coordinator. Did you get all that?
Okay.
I think so. Wow. Okay.
Right?
Yeah.
I literally had to read verbatim.
I know. That's great.
In other words, the answer to who's in charge is yes.
Yes.
And that's exactly,
they all
I
report
guess,
to
what
the president.
the American people want to hear.
Right.
All right, Paula.
Paula, thank you so much.